What is going on, everybody? It's Mark Cargill, the lead faculty and CEO here at Modern Pain Care. We make you the complete clinician. Up for another episode of the Modern Pain Podcast. And this week, we're going to talk about probably one of the few quotes I've ever had that may have been worth something that I've said. Jared took it and felt it was worth putting on Jared's Instagram, which is when I knew I made it big time right there. When I can make Dr. Jared Hall DPT's Instagram feed, that's a feat. I joke, but it is. Jared's obviously built quite a following on Instagram. If you aren't following him, you should be. But it's around manual therapy, and if you've listened to this podcast, you know I've had the journey with manual therapy, and it kind of left me disappointed and feeling like I wanted to quit, and then, kind of put it in perspective. It's still part of practice, but, I'm not, enamored by needing to be a manual therapist, or that it's something that I need to define myself by, but it can have its place. And it was actually in a conversation with Peter O'Sullivan and Joletta Belton on the podcast, a while back. Maybe we'll link it in the show notes here. You guys can listen to it. But it was just a discussion and something I said that kind of came to my mind as I was hearing these two talk about some of the things they were doing, experiencing with their clinical practice, and then Joletta's patient experience. But before we get into that, let's hear how Jared's doing. How are you doing, Jared?
Man, I'm doing good. I wanted to talk about this, just in a really quick episode, kind of almost like a soundbite episode to get people thinking a little bit, because I've seen this quote floating around on the social medias, and I recognized that it was a quote from you back a few years ago. And if I remember correctly, I actually think it was in Peter O'Sullivan's master class that we had in our Lifelong Learning Academy. Is maybe when that originally came up. Maybe it was the podcast. I don't know. We've done a lot of these things now, so it gets confused. But when you said it, it rung a bell for me because I had never thought about it exactly that way, or I had never put it into words. But what you said was manual therapy should be supportive, not corrective. And I really liked the way that sounded, because the message that it sends is immediately manual therapy is okay to do. And I think that a lot of people hear what we are not saying, and a lot of people maybe hear what some other people are not saying and think that because manual therapy doesn't do a lot of the super sexy special things that we have been taught that it does, that it should never be done. And that's probably just not very accurate. So it immediately qualifies that manual therapy is okay to do. But what it does is it qualifies that with stipulations. Manual therapy should be used to support your patient. It should help with the process. It should help with their plan of care. It should support whatever the end goals are. It should not be corrective. So meaning it probably shouldn't just be this completely passive, 100% passive experience where the patient perceives that they're broken, for one, right? To correct something means that it is incorrect or dysfunctional, and that they need to be fixed, for two, right? So to me, that concept also, when you read between the lines, it sends the message of manual therapy being more of a dancing with the nervous system type of intervention versus a correcting the biological system type of intervention. So, since you're the originator of the quote, I'd like to hear your thoughts rather than my interpretations.
I think it just came through, and it was, I don't want to say, it was kind of an aha moment, but it was during their discussion and kind of back and forth of how Joletta was seeing it and perceiving it, and how, current science and what Peter O'Sullivan was talking at the time, how we kind of know what it does. And I think, Peter probably gets unfairly said, oh, you think this manual therapy stuff's horrible. And I know I've been labeled as a hater on manual therapy. I just think a realist on the fact that it doesn't do anything amazingly special. Whether you want to be a manipulator or mobilizer, I don't see how you can look at that and the data around it and say that, of course, you can dig a study here and there, and then you can drum up all these fancy statistics of numbers needed to harm if you don't do it, which you can do pretty much with any intervention. That's a whole nother podcast. Numbers needed to harm is probably one of my more annoying statistics because it's a marketing statistic in my opinion, but I get where it comes from. But anyway, where manual therapy doesn't mean you don't need to do it, but just how do you position it? And if you can look at it in your way you operate as a clinician, whether you're a PT, chiropractor, or whatever, that I'm going to support this person And it becomes like it's not the main event. It's not the thing that should be the center stage of what we're doing. It can be part of it, especially if the patient values it and they feel like it needs to be part of it. But it needs to be positioned at this is a support to get you to do. And Matt Lowe's one of the people that's really pushed me to think this way. The really important intervention is how we're going to get you doing things that are valuable in your life outside of this freaking clinic, off of this plinth. But there's just been this manual therapy environment where it's all about what we do with our needles or our hands or these things. And I'm not saying it can't have a place, but if it isn't in the light of getting people off of those interventions and not needing to be on tables, because that's not where life is lived. It isn't lived laying on a table. It isn't lived where life is lived is outside those four walls of your clinic. And I think we're doing people a disservice by continuously pushing narratives of something broken that needs to be corrected. It's good marketing. People dig it. People will buy that message because it's been going on forever. But I think we can do so much better. And I think we have a duty to do better. Science is telling us it ain't it is not what is happening with manual therapy, that we're fixing or correcting things. And yet we still push those narratives on people, which usually, I mean, some people can take it and not get too worried about it and they navigate life, but there are a lot of people where that is a very disabling, costly narrative that can take them away from life. You mentioned in our last podcast about the Defense and Defect podcast for your patient who was sold a bag of goods of how certain movements were going to be, horrible, catastrophic to his back's functioning moving forward. And I think the more we paint these pictures of, defects that need to be corrected, the more we create people like that are not in life because they're paralyzed by this movement jail we put them in unnecessarily, which I think we got to do better than that. So I don't know what's been your experience with that mindset around manual therapy, kind of supportive versus corrective, Jared.
Yeah, I mean, for me, I think that from the clinician standpoint, it matters a lot how you clinically reason where manual therapy fits in and when and why. But then from the patient perspective, it matters a lot the way that manual therapy is maybe explained to them and what it's doing and why it's being included in their treatment and their plan of care. Because like you mentioned, the guy that we talked about last podcast episode, defense versus defect, the wrong message can stick with some people. And no, it doesn't stick with everybody. And that's the argument I get. Oh, I say this stuff to my patients all the time and everybody's fine. Well, you're full of shit because not everybody is perfectly fine. That tells me that you're just being ego driven and not necessarily even aware of when you're sending some unhelpful message to people. But yeah, a lot of people are fine, but not everybody is. And is it worth risking creating a situation like the gentleman I talked about last podcast? And I've seen 100 or 1,000 of people with beliefs like that. People that quit playing tennis because their SI joint gets out of place and they're tired of having to go get it put back in, and quit doing this type of exercise because it over facilitates those muscles, and you don't want to over facilitate those muscles because you're going to have this posture and blah, 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 right? So the messaging that comes with what manual therapy is doing sends, a deep understanding about how the body functions to patients. And we want that understanding of how the body functions to probably be a little bit more robust and adaptable rather than defective and maladaptable. Yeah.
I think when people understand the support and, we're not correcting, we're decreasing sensitivity to movement through, applying passive movement. Strangely, the body's, especially when you got a good narrative and a confident therapist and all these things where you can nudge the body with, especially if your narrative is amazingly provocative and, resonates with the patient, regardless of its scientific merit, whether you're saying, hey, we're just decreasing sensitivity through some movement to help you get less pain and move better, or the corrective thing. I mean, again, working alongside osteopathic physicians, I facepalm regularly on the narratives of how broken and unaligned and frail and fraught these folks are. And again, a lot of people go in and out of their office, doesn't really matter. They don't really get too worried about it. They get whatever treatment done to the area and they move on. But there are a lot of people where, holy cow, like you said, have stopped life because of this fear of things slipping in on the place, which to me is just that we got to do better as professionals. Get up with science. You can't bury yourself in an association of where it's just confirmation bias. We're all doing it the right way. Well, the only reason you're doing it the right way is because you're not exposing yourself to any other viewpoints on it. I mean, if you publish the same journals and go to the same conferences all day, yeah, you're going to feel like you're knocking it out of the park with everybody. And that's just, we're going to seek confirmation. That's what we do as humans. But our patients deserve better, and I think we can do better and I think just that simple look of manual therapy as supportive versus corrective, it's probably the way, if I was to summarize how I transitioned, how I looked at manual therapy, that would be the way I'd think about it. It is not the center stage main intervention. It can be part of a supportive effort to get a patient off of bed and back into life, but it is not any need to get overly complex with it. You don't need to get ridiculously overtrained in it. Be good technically, and being good technically is how you explain it, how well you get a patient handled comfortably to where they can let go and be confident with what you're doing. You got to be able to nudge and move things. And there's ways we teach it that there's some skill to it. I don't think it's completely like, a monkey could do it, but, for some of the manipulative techniques, I think you could teach a layman to go in there and whack and crack pretty easily. I don't think there's as much skill, as on that side maybe, but, the skill is the interaction, which I think, sometimes we don't realize, especially some maybe of the guru manual therapists. If you look and step back, there's a lot of the non-specifics and contextual things they set up to where they're just masters at getting patients bought into what they're doing. And they're going to have a great response, even if the technique isn't as perfect as they need to, just because they're so masterful at that communication piece. But anything you want to leave folks with, Jared, before we wrap up today?
No, just issuing the challenge of this week, go into the clinic and challenge yourself to think about manual therapy as supportive, not corrective. Challenge yourself to explain manual therapy as supportive and not corrective, and start changing the narrative. So hopefully, at some point in time, we're all speaking the same language.
Yeah. We're when you're hearing this, we're probably in the midst of our challenge that we're delivering right now to folks as far as a 5-day challenge. We'll probably have it run more than once just because it's one of those things we want to offer some abilities for people to get involved free. Just challenge your thinking, challenge your way in clinic, start getting yourself to start moving into more of a person-centered, patient-centered way of getting after it. That still allows you to be a skilled clinician, just, reconceptualizing what it means to be skilled, and supportive versus corrective is definitely one way to move that direction. So we're going to leave you with that today. Hopefully you guys enjoyed the episode. If there's anything else we can talk about that would help you in your journey, definitely let us know, Jared or Mark at modernpaincare.com, and we're happy to talk about whatever you think you would like. And if there's any other questions or concerns you have, definitely reach out. You know where to find us on social media, and we're happy to have those conversations. So until next time, you guys have a good one.